Management of blunt chest trauma depends first on one thing: hemodynamic stability. Let's walk through a stepwise exam oriented approach. So, the first most important thing in a patient who presents with blunt chest trauma is to understand if they're hemodynamically stable or not. And by this, I mean if the question stem mentions that the patient has the blood pressure is less than 90/60, that means that they're hypotensive. If they're tachycardic with heart rate greater than 100, if there are signs of shock, if they have an altered mental status, this means that they are hemodynamically unstable. And the first thing to do in that case would be to resuscitate the patient and evaluate the patient. So, by resuscitation, we do all of the ABCs in the ER. We give them oxygen. We get IV access. We give them fluids, blood, whatever that is needed to resuscitate the patient. And we also further evaluate the patient with EFAST, which is basically done in order to identify if there is any signs of internal hemorrhage, if there is any bleeding in the peritoneum, or any sort of internal bleeding that is happening. And we also get a chest x-ray done as well to see if there's any pneumothorax, and also an ECG to see if there's any myocardial contusion. Yeah. So, once this is done and you further evaluate the patient, we do any stabilizing intervention. So, if, for example, the chest X-ray showed that the patient has a pneumothorax, so we will put a chest tube inside the patient. And then again, we are going to evaluate the patient further. If the patient continues to be hemodynamically unstable, then we get the patient to the OR and do a thoracotomy. Okay. Now, let's suppose that the patient was hemodynamically stable. Then we have to understand if this was like a high risk injury or not, if this was any serious, if the patient has any serious injury on examination. So, is there any chest deformity? Is there any severe chest pain? Is the patient in any respiratory distress? So again, we do further evaluation. We do resuscitation and evaluation with an EFAST, portable chest X-ray, and an ECG. And if, however, this was a low risk injury, then we can either observe the patient and even discharge the patient as well. But we also have the option of getting further imaging done, like CT scans, depending on what the condition of the patient is. So, if they're hemodynamically stable, then you can go ahead with CT scans as well. So that is the approach for blunt chest trauma.